Ginny Milanofi. I'm coming to you for my 11-month Surgiversary. So today is June 7th, 2022, and I had gastric bypass surgery on June 24th, 2021. So it's been a little over 11 months, but this has been a rough month. I'll get into that in a little bit, so it's been a little over. But as my beginning weight was 316 pounds, my weight today is 181 pounds. So I have lost a total of 134 pounds. So that's exciting. I forgot last time I told you I was going to tell you my weight. And I told you my beginning weight and I told you what I lost, but I didn't tell you what I weighed then. But that's okay. You can figure it out. You're smart. So I have some notes here again. I can't believe that I haven't shared with you that I have had a B1 deficiency. And it's not very common, but it can be very serious. So I want to share it with you. I was having brain fog. In fact, I was having it so severe that I wondered if I was getting like dementia or something. I could not concentrate or anything. And they told me that I had, my B1 was level or low, but they said, but we'll just look at it next time. Until finally I said, are you sure? Because I'm having some symptoms. And I told them what my symptoms were. And then they sent me to the ER because they said, well, if you're having those symptoms, they can become, and I looked it up, it can lead to irreversible brain damage if you leave your B1, if it goes undetected or if you don't treat it. It's okay. I'm just thinking as we're taking a walk that when I was talking about the B1, that I was going to explain to you that that's a lot of times why I couldn't find my words too. Remember, so many times I said, oh, I can never find my words. And I think that was part of my B1 trouble, was I just couldn't concentrate. I couldn't relay things. So I think that was a problem too. So that has gotten a little better. It's not perfect, but it's gotten some better. I was blaming it on my medications, but I think that was part of the problem. So I'm hoping you'll see that improve. Make sure that if you're having problems, advocate for yourself, because nobody else is going to. So I let them know that I was having brain fog. Some other symptoms are dizziness, faintness, pins and needles in your fingers. I mean, these are things that I had. And I was getting kind of scared because I thought I was just, maybe getting some dementia, or I don't know. I was getting very forgetful and I couldn't concentrate. So it's just something that I want to share with you. So since then, they have put me on a different B complex. They also had me get B1 shots for 5 days in a row, because I guess you can't get too much B1, or if you do, you just pee it out. It's not one that can hurt you. So, I mean, just listen to your body and make sure that you tell your doctor and keep on them. If they don't listen to you right away, keep telling them, because nobody else is going to advocate for you like you are. So I just encourage you to talk to your doctor, and if you have to push it or see a different doctor. Okay, so the other thing that I would share for this month would be that although I've had pretty successful weight loss, it has been a pretty rough month. But it might not be like the rest of you. This is my 11th month, and I had, as many of you know, I had double knee replacement this last month. I had it on May 3rd, and it's a rough road. So I have dealt with, I don't want to say depression, but really down days, feeling like I'll never get better, feeling like I'm stuck like this, nothing will ever get better. So that's been some things that have been going on. And also after this surgery, I got sick, nauseated again, not feeling well enough to eat or to eat enough. So I've had to really push my protein again and my water. and really try to push it. I haven't been able to go to all of my PT, which I really hate, because you really need to go to PT when you have knee replacement surgery, and I just have not been well enough to leave the bathroom. So I have that playlist below about my knee replacement if anybody's going through that too. Or I think I have it with this one. I think I even have those on here, right?
Right.
Is that right?
Yeah.
Okay. So this has been kind of a rough month for me. So, but I don't think most of you will experience that at 11 months unless you go through this. I also wanted to mention that there's kind of I have my husband Mark, and he's a great caretaker and he takes good care of me, but he doesn't know what I'm going through. There are some Facebook sites, or reach out to me or somebody else that you know that's going through this, because nobody really knows what we're going through. I have done that with my knee replacement surgery too, because nobody really knows unless they've gone through it. There's some great ones on Facebook. I'm sure there's other ones too. But also reach out to me if you want to talk or you need some help, because it's a road. Both of them are. So stay positive, keep praying, and keep looking up. And we'll be happier this next month because I'm moving more now, right?
Right.
So we'll see you on the next one. Is my year. It will be a year later this month. A year! Can you believe it? It was a year ago.
Wow.
I've lost a whole person almost. I mean, I have lost a whole person.
Mm-hmm.
Yeah. Okay, so we'll see you next time. Love you.